or it gets so bad and then, they realize that indeed it's something that could be treated by
Well,
our
fortunately,
psychiatrists?
we're getting more and more people presenting, and I think more and more of them are coming early. So it was bad, but I think it's getting better now. I mean, there's more enlightenment about the condition now, so people are coming in to try and seek care. The problem really comes with the level of management that is available for dementia.
Right.
Like I said, it's a progressive condition. In some of them, the progression can be halted. When you halt the progression of the disease, the rest of the brain is able to compensate to some degree to give the person some level of normal functioning.
Okay.
So with these people, we'll do something, there'll be an improvement, and then that person will be fine. But in most cases, it continues to progress. So even when they come in for treatment, we don't actually halt the disease in a lot of situations. So some people can lose hope, and then they need to understand that it's something that the family and the society are going to be dealing with for some time.
Is it reversible?
Reversible, no. In most cases not. In a very small percentage with specific causes, they can reverse. But like I was saying, if you stop some of the causes early enough, the brain is able to compensate for the function. So you might not even notice that this problem occurred before. But yes.
Okay. At what age should you be worried?
You should start worrying from your 60s going. I mean, it can happen earlier. We have those that we call vascular dementias, essentially strokes that lead to dementia. So if you have hypertension, diabetes, high cholesterol, it predisposes you to getting that one. So you could get that one a little earlier than the one that's coming from the 60s.
Okay. We had a care worker here a couple of weeks ago, and we were talking about caring for the elderly and how different it is from caring for younger patients. We don't have a situation in Ghana where people can be put in homes, so a lot of people are dealing with these issues at home. What are some of the basic things that they can do in order to make somebody who has dementia feel more comfortable with their surroundings?
Well, people with dementia, what they really need is love and understanding. I think once the family are able to understand the condition, understand what the person is going through, they all have different ways of adapting. It presents in different ways. So different people are faced with different problems. But once you approach them with love and understanding, then it's easier to cope with it, knowing that this is what is happening with the person. One big problem that they tend to face is that the person gets up, leaves the house, and then gets lost because they don't know where they are. I have a patient who the system they've adopted is that they've let everybody in the area know that this is the condition that their mother is suffering from.
Right.
So every time she's allowed to walk around because exercise is good for them. So she's allowed, but when she gets past a certain point, the people in the area stop her, stop her, and then bring her home.
Yeah.
So she's not going to get lost.
Yeah.
So we don't have homes, but we have societies that can help us.
Right.
If we would reach out to society the way we used to do in the past, it would really help in the management of dementia. You see.
I read somewhere that dealing with dementia is similar to dealing with Alzheimer's because it's all to do with the loss of memory and stuff like that. Now, we know there's no cure, but does repetition, regular tasks, regular routines, do they help with the day-to-day dealing of dementia?
Alzheimer's is a form of dementia. It's actually the most common form of dementia, and that's a good question. Repetition is helpful, giving them some routine as long as they're comfortable with the routine. They keep on fighting the routine, then it's not really going to help. Other things that are helpful, like with everything, prevention is better than cure.
Yeah.
So we have something we call a cognitive reserve. The more you use your brain, the more brain there is to lose, essentially.
Okay.
So this is where they suggest doing crossword puzzles, Sudoku, that sort of thing. Like challenge your brain, read things in different topics.
Okay.
Keep your brain stimulated. It tends to
so maybe even
push
like
back.
Checkers,
Yeah.
board games.
Yeah. Push back, or words are better.
Words are better.
Words are
Okay,
better.
all right.
Words are better. So reading. So you push back the onset of dementia and to some extent the severity with which it develops. Also, like I mentioned with the hypertension and the diabetes and the cholesterol, going for regular checkups, making sure you know what your status is, it can help. And also healthy living, general healthy living, eating healthy,
It can prevent an early onset.
Yes, there have been recent studies that have showed that that has a very significant impact in pushing it back and improving the course of the illness.
That's very interesting. Now let's look at the people who are scattered across the country. You know, in Accra, we are very privileged. In Kumasi, we'll be privileged as well. In the cities, of course, we'll be privileged to access medical doctors like you. But for those who have very limited access to health, it becomes a problem. What kind of situations do you hear, for instance, in areas where there is a deep concentration of witch camps?
It's terrible to think about. These women, they get confused, they say things which don't make sense to people, and then, like you're saying, they get thrown into witch camps with horrible conditions. Horrible conditions. These people are suffering from a condition. We feel very bad about that, and we like to reach out there as much as possible, but we have the situation we have. But yes.
And the situation is limited resources,
yes,
and few personnel.
Yes. Well, with the new Mental Health Act, we are hoping to improve the access to psychiatry all over Ghana, especially in those areas.
Will that act, for instance, help with treatment of this being under the NHIS, or certain parts of treatment being under NHIS?
Mental health care is free in Ghana, as per the law.
All aspects of it?
Yes, according to the law, all aspects of it. According to the law, all aspects of it. So, what's the problem? The problem we're really having right now is access.
Right.
There aren't enough of us in enough places for people to get access to the healthcare they need.
Okay.
So with the new law, we're hopefully going to get funding, increased amounts of staff, and then increased coverage, so that we can help intervene in all these areas.
Mm.
So how do we, you were here this morning talking about it as part of the drive to educate people, but have you seen enough work being done in that area?
We're doing more, like I'm saying, we're seeing more patients earlier now, so obviously something
we're getting a good understanding?
We're getting a better understanding. Okay. We're getting a better understanding. So obviously something is being done, but obviously more could be done. More could be done. I mean, as long as you still have people with dementia in witch camps, nobody can sit down and say, we're doing enough.
Yeah. So, I mean, are there any plans for public education in that regard? Because not everybody will be bringing their mother, father, auntie, grandma, to a psychiatric ward. So if they're at home, they've watched the program, they've seen that maybe these are early signs of dementia, they'll bring them to you, then afterwards they're back home. So what are some of the things that they can be doing at home to make these people's lives more comfortable?
Okay.
Or even just to be able to live at home and not be worried about?
Okay. Like you mentioned, a steady routine is a good thing. A steady routine is a good thing. Exercise is helpful. A good diet is helpful. They should go for the regular checkups to make sure that there isn't any of the hypertension or diabetes or those things I mentioned compounding the illness. Another thing that's very common in them is depression, which aggravates the illness. So they really need to come for checkups so that we can follow up on this. But the routine you mentioned, good diet, good exercise, and company. Don't just lock them in a room.
Yeah, because our attitude towards these people is different as well. We end up getting very agitated. We end up sometimes shouting at them, degrading them because they're not able to do the basic things. So,
see, their personality disintegrates to the point where they are like children. They are like children, and people start treating them like children, shouting at them. It's counterproductive. It's counterproductive. So they need company, they need love. They need exercise, they need to have a good diet, and they need their regular checkups.
Okay,
that's interesting. A very good one there. I mean, my problem really is how we treat people who, volunteer to go to psychiatric hospitals for help, really. I mean, once I was going to interview Dr. Osei, somebody saw me drive into the place. The first question they asked was, are you all right? What's wrong with you? Why are you going to the psychiatric hospital? But it's just a hospital. It's like going anywhere to seek treatment for malaria or anything.
Imagine, I get that question already. So what if I walk?
Try working there. Try working there.
Oh, it's worse if you work there?
Yes, there's this whole thing. It's
oh, did they say that it's contagious?
It's contagious, all sorts of things, yes.
Imagine. The fact that we don't know, we just come up with our own theories.
Yeah.
So because Dr. Abin works there,
really.
and maybe a person who has an ailment has touched him,
we assume that
he also has a bit of it at the moment. Oh, Dr. Obing, sorry, why?
We need to change our attitudes.
Very much.
Very much.
Yeah.
All right, so that's been the health segment brought to you by Lipton Tea, inspiration flowing from nature. We'll be back in a few moments with more here on A New Day.
Thank you.
Thank you.